Hi everyone and welcome. My name is Laura Christine Sainz and you are watching Live Vegan Vibrantly, how to easily heal your body, look beautiful, and eat deliciously. Today I have the absolute honor and privilege to interview Dr. Alan Goldhamer. Dr. Goldhamer has been the director of TrueNorth Health Center in Santa Rosa, California for the past 30 years. He completed his training as a chiropractor in the United States and as an osteopathic physician in Australia. Dr. Goldhamer was the principal author of 2 papers published in peer-reviewed index journals evaluating the effect of water-only fasting in the treatment of high blood pressure and diabetes. He is the author of the Health Promoting Cookbook and the co-author of The Pleasure Trap, Mastering the Hidden Force that Undermines Health and Happiness. So without further ado, everyone please welcome Dr. Alan Goldhamer. Thank you so much for being here today.
My pleasure.
So Dr. Goldhamer, let's jump right in and let's talk a little bit about your book, The Pleasure Trap. So for the people that may have not heard of it before, can you tell us a little bit about it and the background?
Well, sure. When Dr. Lyle and I began working on the concepts of the pleasure trap, we understood that patients were having serious problems with obesity and the diseases of dietary excess, all the problems with cardiovascular disease and diabetes, autoimmune diseases, and yet it wasn't exactly clear why it was people were having so much trouble making the type of diet and lifestyle changes that we advocated. We knew when they did the right diet, they got well. But getting people to do the right thing was difficult. And so Dr. Lyle's background as a psychologist, I think, helped him formulate many of the concepts described in the pleasure trap. Basically, the idea is that people are addicts. They're fooling their brains with chemicals that are added to their feed. And as a consequence, they consistently overeat and develop these diseases of dietary excess. And when they try to stop, it's very difficult. It's not an easy thing. Just like it's not easy to quit smoking or drinking or using cocaine or heroin, it's not easy to give up the chemicals that are being added to their food. And the chemicals that we're talking about include things like sugar, oil, and salt. So when we add these highly processed chemicals to our feed, whether it's humans or other animals, the behavior is predictable. And so what we advocate in the pleasure trap is escaping the dietary pleasure trap by avoiding these food products that lead to disease and debility. And in addition, we talk about when it's too difficult to do on your own, we have a tool called therapeutic fasting, which can help people break that cycle very effectively, undo the consequences of dietary excess, and reverse conditions like diabetes and high blood pressure. We know that under conventional medical treatment, if you have diabetes or high blood pressure, which, by the way, the majority of people do by the time they reach retirement age, the medical treatment is take drugs. And you have to take the drugs for the rest of your life. Because the promise that medicine makes to you is if you do what you're told, you'll be sick forever. You'll never get well. And of course, our approach is a little different because we're saying, well, instead of taking drugs for the rest of your life and being sick forever, what we want to do is actually get rid of the causes of the problem, which is the dietary excess that leads to the difficulty. Adopt an exclusively plant food diet that's free of what we call SOS, which is obviously the international symbol of danger, but also stands for sugars, oils, and salts. And of course, under sugars, we include refined carbohydrates and all these heated, treated, processed, chopped, diced foods that, are pseudo foods. And what ends up happening is people lose weight, they recover their health. If they have too much difficulty giving it up, we fast them and then apply an exclusively plant food SOS-free diet. And the results speak for themselves. If you look at the studies that are freely available on our website, you find that we have the largest effects that have ever been shown in treating high blood pressure in humans, with an average effect in stage 3 hypertension of over 60 points. Essentially, all the people with high blood pressure that go on an exclusively plant food SOS-free diet will eventually normalize their blood pressure, eliminate the need for medications, and if they use fasting, they can do it more quickly.
Awesome. Thank you so much. So can you tell us a little bit about why you think that, salt, sugar, and oil are so bad for the body? Or what is your perspective on that? Because so many different experts have different opinions on it, and I'd like to hear yours.
Sure, nobody wants to give up all of these addictive triggers because, some will give up the oil, but then they use the sugar and the salt. Or they'll give up the sugar, but they will keep the oil in them. Because when you give them all up, what you're left with is a whole natural food diet. You're left with fruits and vegetables, minimally processed grains, beans, and nuts and seeds. And this is a much less overstimulating diet. And so for addicts, the idea of giving up all their addictions seems overwhelming. It just doesn't seem very practical. And in fairness, the people that we have the best success with are people that are highly motivated. They might be highly motivated because they're in agonizing pain and debility and they're trying to avoid death, or they're highly motivated because they're very intelligent, or perhaps they're motivated by moral, ethical, or spiritual reasons. There are other driving forces for them. But whatever it is, there are a relatively small percentage of the population as a whole that are highly motivated to be healthy and they want to be happy and live a long and vibrant life. And for those people, adopting a diet free of these dietary chemicals works really well. For people that don't really want to give up their addictions and they don't want to have to actually do that hard work, then this is, doesn't seem relevant to them, and that's fine. I'm not pretending that our recommendations are necessarily going to be attractive to the wide population as a whole. But for people that want to get well, this is a model they can let the proof be in the pudding. And they can look at our data. We just have a paper that came out just this week in the British Medical Journal, which is a major impact journal. And it involves our treatment of a patient with follicular lymphoma. Yeah. So this person had large lemon-sized tumors that had been tracked for 2 years under conventional medical monitoring, underwent a 21-day water fast, resolved their lesions. We have a 1-year follow-up. We published it in a major medical journal, British Medical Journal. And it shows that even in these very serious conditions, sometimes just a very simple natural approach like fasting, followed by an exclusively plant food diet free of sugar, oil, and salt, results in consistent, sustained benefit. So for people that are advocating the Dr. Atkins diet or the, whatever filet of sole diet or whatever, I'd say that's great. Let's see the data. I know what we do using a plant-based diet. If they've got data that supports excellent outcomes, that's great. I'm not saying that this is the only way that people might be able to achieve health. It's just the way that we believe is most consistent with the scientific literature and certainly consistent with our own clinical outcomes. And we're doing our best to try to document that clinically and prove that, at least to the degree that we're able to monitor and modify people's behaviors, we can help them get well.
Awesome. So I want to go back to that lymphoma study. Did you say that their lemon-sized tumors completely went away, or they dissipated, or what happened?
Well, during the fast, they went from easily palpable large tumors to completely no evidence. We do have CT scans before and after. You can see the study to see the magnitude of the reduction of lesions. Lesions reduced to the point where they're no longer palpable, but there's still evidence of tracking, as you would expect. Patients done very well clinically. And the important message here is that, health results from healthful living. And healthful living involves diet, sleep, and exercise. And fasting can be a safe and effective way of giving the body a chance to get back to healthful living quickly. Mm-hmm. So changes that take place in a few weeks of fasting might take, much longer with careful feeding, but many conditions, if you just get people eating, sleeping, and exercising appropriately, are able to resolve themselves. And you don't have to believe that you have to be sick forever and there's nothing that can be done and learn to live with it. And what do you expect at your age? And you have to be on drugs and pills and potions forever.
Right. Okay, great. So, Dr. Goldhamer, tell me a little bit more about the water fasting. So, like, for instance, with this lymphoma case, or you can use another case, how long? Does it depend on what the case is or the person?
Yes, it depends on the condition and the state that the person's in. And sometimes it'll be anywhere from 5 to 40 days on water only. Sometimes it'll be one fast. Sometimes it'll be several fasts over time. We've had patients where we've had to do multiple fasts in order to get the desired result. Some fasts go a long time. Other times it doesn't take very long. You see relatively quick change. I have many patients, though, just preparing for the fast, doing the diet before they even come in, they get well. Yeah. So, it happens frequently. Just getting them off the gluten and the dairy and all the processed crap over a relatively short time may resolve the symptoms they thought they would they would have to fast for. So I think it's always about healthful living. Fasting is just a tool to make it happen quicker. And it's something that we have a lot of experience in. In the last 30 years, we've had 15,000 people undergo fasting at the TrueNorth Health Center. So we have a lot of us doing that. Most of the patients that find out about us are referred specifically for medically supervised fasting. So again, we have a natural bias. I'm sure there's many, many more people that could tell you that, they never had to fast, they just did the diet, they exercised, they got well, they lost weight, they overcame their blood pressure and diabetes. I tend to see the people that, despite their best efforts with diet and lifestyle, are not getting well. Like, for example, our colleague, Dr. McDougall, will tell patients if for some reason they don't recover fully with his approach, he'll say, well, I'm terribly sorry to tell you this, but you have to go to Goldhamer's place. We're like punishment. Because we tighten the screws even further. We're all using plant-based diets and all this kind of stuff. In our particular approach, we're very, very strict. And we can get that level of compliance because fasting helps neuroadapt people's tastes so they can eat the food without the sugar or the salt or the other things that people feel is so necessary for them because of their addictions. It really helps them break that cycle. And of course, you're in a contained setting. You're seen twice a day. You're going through intense educational programs. You're working with doctors that aren't complete idiots, and so you can get good advice about getting off the toxic waste that sometimes is used in managing your symptoms. So all of that together can be very helpful. Not necessary for everybody, because if people adopt a plant-based diet, get exercise and sleep, an awful lot of things just kind of heal themselves up. But for when it doesn't, TrueNorth Health Center can be helpful. The other people they want to make the changes, but they're having too much difficulty. It's too difficult. It's just like some people, you tell them, look, you got to quit drinking. And they quit drinking. Other people, it's a much bigger struggle. They need to be, maybe they get an outpatient support program, or maybe they do inpatient support program. Sometimes they do it for 30 days, sometimes they do it for 90 days, sometimes it takes many attempts. So depending on the person and their condition, their ability to comply, how serious their condition is, will depend on if they have to fast, how long it has to be. And unfortunately, we don't always know ahead of time what the ideal amount of time is. Even though with our experience, we can give them a pretty good guideline usually. You don't know, is it really going to be 2 weeks or 3 weeks? It's ideal. So at TrueNorth Health Center, we're pretty flexible. We let people come as long or as short as they want. They don't have to commit to anything. They're not locked into the program. And the consequences is we try to adapt to whatever it is their body ultimately, decides is necessary. What I can tell you some generalities, though. For example, a person with high blood pressure that has moderate levels of hypertension, so their blood pressure, say 160 over 100 or something, that person may, everything else being equal, be fasting 10 to 20 days. Somebody that has much higher blood pressure, maybe it's 220 over 120, they're on a lot of medications, they might be with us 4 to 6 weeks, depending on the condition. I have patients that are here over a year because it takes sometimes a long time to get off all the multiple medications that they've been addicted to. Wow. And so you can't just arbitrarily discontinue everything. You have to sometimes wean these things down, particularly drugs like steroid medications or psychiatric medications involving treatment for anxiety and problems with rhythm medications, thinners. These are medications that have to be managed with some delicacy.
Yeah, absolutely. So I'm really curious, do you have to keep the people separate from the kitchen so they don't?
Actually, not. Interestingly enough, the one thing that isn't a problem for most people fasting is hunger. After a couple of days, most people really don't they go to cooking classes. Many of them come down to the dining room during meals to interact socially and really don't seem to have much problem with food once they adapt to the fasting state. Really? Once your brain changes from burning its normal fuel of glucose to burning beta-hydroxybutyric acid, which is a fatty acid byproduct from fat metabolism, there's a blunting effect in this ketosis state where you really aren't hungry. It's not normally a big issue. There are a lot of other things that can be very entertaining during fasting, but hunger usually isn't the dominant thing for most people.
Huh. That's interesting.
Yeah, fasting can be intense, sometimes even miserable, but fortunately the results are good enough that people forgive us.
Well, that's always good, right?
Yeah.
So tell me a little bit more about the nonprofit organization and what's upcoming for you guys.
Well, we have the TrueNorth Health Foundation is a 501c3 nonprofit foundation. Its mission is public education and research. And so we're very excited because we have been acquiring some outstanding new employees. that have interest and experience in research. One of which is a woman's name is Tasha Myers, who's a PhD postdoc from Columbia University, and she helped us with the first paper she helped us with was actually this paper that just came out in the British Medical Journal. Mm-hmm. She's an excellent writer and researcher, and she's been very helpful. We've added new additional medical staff, Dr. Anthony Lim. We've added a registered dietitian, David Goldman, who joins us, having been spending the last 3 years at Facebook, working a vegan program out for them. And so this team that we're putting together, along with our existing staff, including Dr. Clapper and Dr. Sultana, Dr. Lyle, are able to begin to ask and hopefully get answers to some of these important questions about what does it take to motivate people to make changes, what kind of changes they need to make, is fasting appropriate, how long should they fast, and what conditions will respond. We know from our experience the type of conditions that we expect to respond, and now we're going to be able to prove it. And what's exciting is even these mainstream medical journals appear to have enough interest that they're willing to publish our papers. And so that's kind of a breakthrough, because in the past you wouldn't have seen major medical journals posting articles on treating cancer that said the approach is to use fasting in an exclusively plant food diet free of sugar, oil, and salt as kind of the theme. That certainly hasn't been done routinely, and it's exciting to see that now there's a change of attitude. I recently had a chance to do continuing med education seminars to 2 different groups of physicians in the United States, and it was interesting to see how receptive they actually were. Very different than, say, 10 or 20 or 30 years ago. Now, this idea that health can result from healthful living is actually catching on. And I know that a lot of it's sponsored by drug money, because the pharmaceutical companies are interested in fasting mostly because they want to come up with what are called fasting mimics, drugs which mimic fasting. Oh, wow. And so they want to know, how is it that fasting is getting these patients well with lupus and with cancer, and then try to reproduce those mechanisms with a pill, which of course would be probably infinitely lucrative. But nonetheless, it's going to give us access to cooperate with some of these major researchers. And we have been approached, and we are working out arrangements to begin doing human subjects trials here at the TrueNorth Health Center in cooperation with some of the major researchers that are in the field. And I'm excited because it will give us access to tools and toys that we wouldn't normally be able to get access to. We're also beginning to receive funding now through some very generous patients that want to see this kind of work done through our TrueNorth Health Foundation. We're a recognized charity, for example, on Amazon.com, so people can select TrueNorth Health as their charity, and then they fund our research. So it's there's lots of things that are happening now as we've moved into the nonprofit arena, which has given us opportunities that we wouldn't have had previously.
Mm-hmm. That's fantastic. Can you tell our audience, about websites and different areas that they can come and help support you, and how they can find you and your events?
If they go to our principal website at TrueNorthHealth.com, or they can also go to fasting.org, either one. It all goes currently to our current website. They'll find all of our articles. We have something called TrueNorth TV, lots of lectures, everything's freely available. All kinds of content, information on both nutrition as well as fasting in particular. Also, we can offer your viewers something that might be of interest. If they go onto our website and fill out what are called the registration forms, we'll offer them a free consultation with me if they'd like to talk about their health and issues and things that they could do that might improve them. That's one of the services that we offer. So all they have to do is fill out their forms, which gets me their health information, and give a call. And there's a no-cost consult. I'll be happy to talk with them about maybe things that they can do that might be helpful.
Awesome. I love that. Thank you so much. And I'm sure everyone's going to be saying thank you so much when they hear this. Sure. So thank you, Dr. Goldhamer. So can you tell me a little bit about how you got into this field? And
yes.
Okay.
Well, I actually got started. My very best friend is Dr. Doug Lyle. Of course, when I met him, it was 4th grade. He was just Doug. He hadn't quite earned his doctoral degree at that point. But he had a very bad habit of beating me in basketball. He would just beat me mercilessly. And so it really got me upset. So I thought I would beat him, and I'd practice, but it didn't work because he practiced. And then I thought, well, I thought I'd get healthier than him, and then I'd crush him. And I read books, and I read books like Dr. Shelton's book and Natural Hygiene and Fasting. I thought, well, that's it. I'm going to adopt a plant-based diet. I'm going to get healthier, and then I'm going to crush him. And the problem is, it didn't work because he adopted the same diet, and to this day, he just still beats me mercilessly every time. So it was a complete and total failure, my introduction to this whole thing. But it did get me interested. And I met a gentleman named Dr. Benish who said he had the best job in the whole world because the patients did all the work, the body did all the healing, and all he had to do was take credit for the good results. And I thought, that's the job for me. So I adopted that as a career choice. I went to Australia and studied with Dr. Burton and finished chiropractic college. I went to osteopathic college in Australia. And then in 1984, my wife, Dr. Moreno, and I came back, and we opened up TrueNorth Health, and we've been operating for 31 years now.
Wow, that is so amazing. I love your story. So what do you like to do for fun, and what are some of your favorite plant-based foods?
Well, I like to play basketball. I play basketball 4 days a week, 3 mornings, 1 evening a week. I'm still hoping someday to beat Dr. Lyle, but, you know, whatever. And my wife and I like to hike, and I spend a lot of time at the TrueNorth Health Center. You know, as far as food, I eat 20 of my 21 meals a week at TrueNorth Health. And there it's exclusively plant-based foods, free of all sugar and salt. So it makes it really easy to eat healthy because that's all the kind of food there is.
Yeah.
And as far as I do a lot of speaking, so I end up traveling for speaking, and that gives me a chance to, you know, see lots of different places and stuff. But mostly it's work at the TrueNorth Health Center, which is fun because we have patients, like 1,000 people a year come through TrueNorth Health, and they come from all over the world. So we see some of the most motivated, most interesting people you can possibly imagine that want to be healthy and are willing to do dangerous and radical things like eat good and exercise and go to bed on time in order to get well. And we work with, you know, people that fast and people that are into fitness. And the staff at TrueNorth Health is also interesting. I work with the 50 people that make up our staff, including 4 medical doctors and 4 chiropractors and 2 naturopaths and clinical psychologists and a dietitian and chef, and we have all kinds of interesting people. So, you know, on a day-to-day basis, we're getting to work together in a kind of an integrative setting. So I've got, I think, pretty much the best gig going of anybody that I've met. So it's a pretty good opportunity. And I would mention that TrueNorth Health has now gone through some fairly rapid growth.
Okay.
And as a consequence, right now we actually have 3 positions that are available. We're looking for an assistant chef that's interested in doing plant-based nutrition. DeJoy Ramses Bravo is an outstanding chef that's been with us for a long time. We're looking for a concierge, somebody that's able to help us with our meet and greet and processing our patient needs. And we're also looking for additional clinicians that are interested in doing something worthwhile with their life and want to do clinical training at the TrueNorth Health Center. So if any of your viewers want to actually do something worthwhile with their life, then they should contact us at TrueNorth Health and let us know how we can help them fulfill their goals of doing worthwhile work.
Wow, Dr. Goldhamer, you're just full of surprises and so much giving to the audience. I love that. Thank you so much for all of the opportunities. So really quick, we have about 5 more minutes. I was just wondering, what kind of education classes do you guys provide for your patients?
Yeah, well, that's an important part of our program. It is a residential health education program. So the way it works is once a person's checked in, they've all gone through a medical exam and history, and we've made sure that they're good candidates and we have a game plan. They're seen twice a day by our staff doctors. So they're on round, so we're monitoring them very carefully. We have 3 educational programs a day that are optional but encouraged. We have a morning program, an afternoon program, and an evening program. And this runs the gamut from yoga, meditation, body use, fitness training, cooking classes, food preparation, lectures with myself, Dr. Clapper, Dr. Lyle. We have, you know, really good live lecture program that happens 3 times a day, every day. Then we also have an extensive set of the best DVDs that have been made on healthful living. And so people can watch those at their own pace, all the units. Everybody has a private room. We have flat panel TVs, DVD players that can watch the programs at their own pace. in between classes. And then, of course, once they're off, if they're fasting, they're resting most of the time. But once they're off the fast, we have excellent food. We have a fabulous chef, Ramses Bravo, who's been with us 8 years. So we, organically grown fruits and vegetables and whole natural foods, consistent with the food in our cookbooks, the Health Promoting Cookbook and the Bravo Cookbook, which are both vegan, SOS-free cookbooks with recipes that are simple enough to make that even I can make them. So definitely useful when people are looking for very simple, healthy food, but still is attractive and interesting and tastes fabulous. And they learn that while they're with us. We also then get involved in exercise and fitness training. And we have a wonderful, David Goldman does a great job in terms of functional movement assessments and training. We also have chiropractors, naturopaths, psychologists. So if people have individual problems that haven't resolved spontaneously with fasting and diet, we can help them fine-tune that. And as I said, we have 4 medical doctors, which are really unusual in that they're not only brilliant, but they actually give a damn, and they're not idiots. And so they're able to really help provide good medical advice. Many of our patients come in not necessarily because they have to fast, but because they want, they come in once a year for their yearly exam and just to have a doctor that can be supportive. Our physicians also offer phone support, so people that need medical consultation but can't come to the center but want to talk to a medical doctor that can be helpful and help them figure out what questions to ask their own physicians or what tests that might need to be done. They do provide affordable phone consultative services. We have TrueNorth Health Kitchen for people that live in the community. They can get their food prepared affordably, and they don't have to shop because they can come to our deli and get their prepared food. We have a speakers bureau through our nonprofit foundation, which makes speakers available both on Skype as well as live presentations. And both Dr. Clapper and myself, Dr. Lyle, travel all over the country speaking at different venues trying to get this message out. And we're happy to do that as well.
So how long can one stay at your facility?
Well, it can range from just a few days. I have businessmen that come and stay because we're less expensive than the local hotel, so they save money and they get their food. Because at $149 a night for a private room with everything,
really,
it's much more affordable than even just a hotel room.
And you get your meals like every day?
Taxes. The twice daily visits with the staff doctors, our educational program, doing your personal laundry, Wi-Fi, everything's included in the daily rate. For a private room, sure, bath, it's $149, a few dollars more if you're a private bath. And so it is affordable because sometimes people do have to stay a long time. Not everything gets healed quickly, so sometimes people have to be with us for several weeks or many weeks. In some cases, people are with us as long as a year or more, depending on the nature of their condition. So, but we are really flexible. So we can accommodate to people's actual needs. There isn't a fixed program that everybody has to try to be squeezed into.
And what about insurance? Do most insurance policies take this or help out?
Health insurance will cover just like seeing any physician. So if you're seeing a medical doctor, it'll pay. If you have Medicare, it pays for your visit, or 80% or whatever your copayment is. Medical testing, like laboratory testing, would be paid just like it would be seeing any physician.
Wow.
The daily rate at the center, the $149, would not be covered by health insurance. They won't actually pay to get you well. But if you'd like to have all your organs cut out, I imagine we could probably arrange for that. But as far as health insurance, not yet covering residential health education programs. But that's, we try to keep the rates affordable enough that real people can come and do the program and be successful with it.
Wow. Well, I just can't thank you enough, Dr. Goldhamer, for everything that you are doing for the planet and the people and health. And I just can't thank you enough for taking time out of your busy schedule as well to participate.
It's my pleasure.
Well, thank you again, and we'll see you soon. Take care now. Bye.